Hi, my name is Rosalia Molina, and today I will be talking about CHF patients. Around 670,000 patients are diagnosed with CHF every year, and CHF is the leading cause of hospitalization among patients older than 65 years old. So today I will be talking about education and also doing a history on the patients. That way we will keep the patient at home. What I suggest is to do a education on the nurses who are discharging the patients home. So I want the nurse to learn how to do a good history first, and second, how to educate the patient and the family member when they are sent home. Okay, well, the first thing is history. We wanted to know how the patient functions at home, for how long they have been sick, for what about activity? Are they exercising? And if they do, how far can they walk? How far can they exercise before getting short of air or getting tired? Is the patient sleeping well? We wanted to know if they use pillows in order to breathe better. So we need to do that. We also need to find out if the patient has any condition that is affecting the CHF, such as diabetes, hypertension, angina, or MI. Does the patient smoke? Do they use alcohol or drugs? We need to find about family. If their family, like close family, brothers and sisters and parents, are affected by CHF. So making a good history is one of the main things. The second thing is education. I just wanted to be very aggressive on this. I want the nurses to be able to educate the patient, and it's not only at the time that the patient is being discharged, but I wanted that education to start when the patient is admitted. One of the main things is diet. We need the patient to have a low sodium diet. We need to educate the patient, and if we need to involve dietary here, we can't. We need to educate patient about diet. We need the patient to have a heart-healthy diet, including 2-gram sodium diet. So we need to talk about food. We need to teach them how to read labels. Okay. Second thing, encourage the patient to stop smoking if they are smoking. So get cardiac rehab involved here. Next thing, we need the patient to be conscious about fluids. We need to have a fluid restriction. We don't want the patient to be drinking more than 2 liters of fluids a day. And we need to explain the patient the importance of maintaining the fluid restriction. Okay, we also need the patient to weigh himself every day. We need to educate them when to call the doctor. If the patient gains more than 2 pounds a day or more than 5 pounds a week, we need the patient to call the doctor immediately. Okay, and if the patient is not compliant, we need to involve family. We need to get the family involved on the education too. Next thing, we need the patient to take the medication as prescribed. We don't want they to stop anything without letting the doctor know. And the last thing we need is the patient to follow up with the doctor after discharge. We want them to follow up with the primary care physician 1 to 2 weeks after the patient is being discharged. We also need to get home health services to come and help them. It is very important. I think education is the main thing to maintain the patient at a home healthy. So it is very important to start educating the patient as soon as the patient is being admitted. Okay? Well, thank you very much for being with me.